Public Works Committee will come to order. We have two resolutions to consider this evening, the first of which is 2023-292, a resolution confirming the award by the Board of Control of a professional service contract with Wolpert, Inc. for geographic information system mapping, surveying, engineering, and adjunct services as part of the countywide stormwater mapping project in an amount not to exceed $874,000 for the engineer and declaring an emergency.
Thank you. Heidi Swindell, Summit County Engineers Office. One of the very first things we were supposed to tackle when we got the countywide stormwater district in place is mapping our storm sewer system for all the communities that are involved. It's a very big project. We've got to map all the outfalls. We have to know where the flow is going, where it starts, where it ends, that kind of thing. And obviously, we need a consultant to help with all of that. They will use drones, they'll use airplanes, so that's part of why the cost is so big. We went out, we actually got 7 total statements of qualifications. They were independently scored, and Wolpert out of Columbus was the highest scoring one, and I'm happy to answer any questions.
Thank you, Heidi. Are there any questions from members of the committee? Members of council? The public? Gloria, you want to move on that? Gloria moves on to 2023-292. All in favor say aye. Aye. Opposed? Motion carries.
All right, thank you.
Thanks, Heidi. 2023-293, a resolution certifying delinquent service charges to the fiscal officer for the Executive Department of Sanitary Sewer Services and declaring an emergency.
Thank you, Chair. Michael Vinay, Department of Sanitary Sewer Services. This is our annual piece where we certify our delinquent sewer service charges, to the tax duplicate. Originally, we sent out notices on July 20th. At that time, we had 7,173 accounts that were delinquent. As of 9/20, that dropped to 3,367. 2.14 million is the total this year. Happy to answer any questions.
Questions from members of the committee? Mr. Whitman.
We have 49,966, and this represents 6% of our total accounts.
Any other questions from members of the committee? Okay. Members of council? The public? Mr. Wilhite moved on 2023-293. All in favor signify by saying aye. Aye. Opposed? Motion carries. Thanks, Mike.
Thank you.
Is there any other business to come before the Public Works Committee? Then we are adjourned.
Planning and Economic Development will open at 4:33. Our first piece tonight is 2023-294, a resolution confirming the award by the Board of Control of change order number 5 to a construction contract with North Electric, Inc. for additional work required on the county lighting upgrade project in an amount not to exceed $110,747.46 for a cumulative increase of 36.9% for a total amount not to exceed $1,846,097.23 for the Executive Department of Administrative Services Physical Plants Emergency. Sir?
Good afternoon. Brian Clark with the Physical Plants Department. This is the last change order on this project to pay for all the extra work. The biggest bulk of the items on this project were when we got up into it was code-related issues. When we got up into the ceilings, the lights weren't properly tied off the way they should be, and also when we went to connect them in, they weren't properly grounded. So we've corrected all that. They also missed some fixtures, which we've picked up for one continuous project. All the lights in our county buildings are all the same. We've got a stockpile of them. They should last 10 years before we have to do anything with them. We're getting some that go out sporadically, but it's a very large money savings and maintenance savings project, which is now complete.
Great. Do we have any questions? May I have a motion? I have a motion from Councilwoman Hyam on 2023-294. All those in favor, please signify by saying aye. Aye. Any opposed? The ayes have it.
Thank you.
Brian. 2023-295, a resolution confirming the award by the Board of Control of the renewal, fifth and final, of a land lease agreement with STC2 LLC, a real property owned by the County of Summit located at 126 Highland Drive, Macedonia, Ohio, in Council District 1 for the use of a cell tower for the Executive's Department of Law and Risk Management and declaring an emergency.
Deb Matz, Department of Law and Risk Management. We have a number of towers, and obviously several of them have come before you recently, where we own the land, a tower company has built the tower, they lease the tower to other carriers, providers who put in equipment on those towers, and then we receive rental income. This is another one of those arrangements. This is the final renewal of that arrangement. It's been a 20-year, so this is 25-year, 5-year renewals, 25-year arrangement. And I'm happy to answer any questions.
Any questions for Deb?
Liz? Deb,
Sure.
Will this go back out for a bid next year after this contract expires, or how does that work?
Most likely not, because the tower company is, under the terms of the lease, required to remove it at the end if we don't re-up with them. So if they want to keep the tower, it's basically a best practical source arrangement. They own it, they built it, they don't want to remove it, they've got equipment on it. It just makes sense to continue with them.
Any other questions? Mr. Wilhite, would you like to move on this? Yes. I have a motion from Mr. Wilhite on 2023-295. All those in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. And Planning and Economic Development will close at 4:36.
At 4:36, I will call the Public Safety Committee to order. First, 2023-296, resolution confirming the award by the Board of Control of a professional service contract with VitalCore Health Strategies LLC to provide jail inmate medical services for a 3-year term from 1/1/24 through 12/31/26, with 2 options to enter into additional 3-year terms in a total amount not to exceed $9,083,078.39 for the sheriff and declares an emergency.
I'll actually handle that one. And you probably noticed that you have a purple piece of paper. We're requesting to amend this piece to change the term. Our current jail medical provider is Southern Health Partners, and they have decided to take a curtsy and leave 30 days early. So we have to get the new medical provider in 30 days early. And so we're requesting to amend the piece to start the term of the arrangement on December 1st of 2023 instead of 1/1 of 2024. We did go out to bid on this. We got 4 proposals in response. We interviewed 3 of those firms. VitalCore was one of them, and then also Southern Health Partners, because they're the incumbent. We thought we ought to give them a chance to answer the sheriff's concerns, because she has had many with them over the last few years. And then also Advanced Correctional Healthcare, who was our former healthcare provider. I will tell you that there is not a local firm that does this work. VitalCore is from Kansas. Both Southern Health Partners and Advanced Correctional are from Tennessee. But after looking through the proposals and with some of the things in mind that the sheriff wants to accomplish in order to ensure that when folks leave the jail, they leave the jail at least in basically good health, with meds that they have been prescribed, and an ongoing prescription and a link to a provider of the medications that they need. Her goal being to try to prevent a certain amount of relapse, which ultimately leads to recidivism with drug-related and mental health-related offenders. And out of the 3 that we spoke to, VitalCore seemed to be the ones that were most attuned to her goals and objectives. The cost between the 3 of them is not vastly different, because you're talking about having to hire a lot of nursing staff, basically medical staff, registered nurses, licensed practical nurses. That proposal also includes finally having a full-time medically trained individual in the intake department so that intake can flow more smoothly. It's, I think, all together in looking at what the sheriff needed, what the contract bare minimum needs. This is going to be the best arrangement for the Summit County Jail. And I'm happy to answer any questions.
Yes.
Deb, what was the reasoning for the current company to pull out 30 days early?
They didn't really give us a reason. They just decided to take their ball and go home, politely. I had just noticed them that we were not contract. So they,
Deb, will there be, so this will be for personnel and medication? Is there equipment? I mean, how much of a setup will this organization need to come in and take over?
the jail already has the bulk of the equipment that they'll need. Generally speaking, X-ray equipment is not, that we don't own it, neither does the medical provider. They usually enter into a contract with somebody who does that kind of work. Now, the good news is that these folks also have a contract with the Stark County Jail. And I will tell you that the Stark County Sheriff is very, very favorable. His opinion is very favorable of these folks. But so that also means they know who the vendors are in the area who can provide the equipment that they might need. I suspect they already have in mind who they're going to contract with as their pharmaceutical provider. They all probably already also have in mind who they're going to contract with for their local physician, because the Ohio Department of Rehabilitation and Corrections rules require that their health authority be a doctor who is local. Because we talked to them about all of those things during the course of the interviews with them. So.
So along those lines, are the nursing staff, is that usually, do they hire those locally, or are they traveling nurses, or do you know
So
how they handle that?
they will begin by interviewing the staff who already works at the jail, even though technically they're SHP, Southern Health Partners employees. Before that, they were advanced correctional employees, and some of them before that were NAFCARE employees. So a lot of these folks have worked at the jail for a while. So they will begin by interviewing current staff. If that's not sufficient to serve the needs that they have under the contract, then they will hire additional staff locally. It's their preference not to use contract nurses. They prefer to have them on staff because then they can ensure that they're getting the training, that they're maintaining their licensure, that, you know, they're following the policies and procedures that Vital Corps has. It gives them a better sense of control over the employees.
Probably better continuity of care that way.
Yeah, absolutely.
Do you have any other questions? Then I'll need a motion to amend 2023-296. Thank you, Mr. Wilhite. So on the amendment, all those in favor? Aye. Any opposed? And then on the, do we need to vote again on the?
Yeah, if you would move it out, so make a motion to.
Okay, so I need another motion to move it out.
So moved.
Councilman Wilhite again. All right. All those in favor?
Aye.
Aye. Any opposed? Thank you. The next item is 2023-297, a resolution authorizing the executive to execute, subject to the approval of the Board of Control, a purchase contract with 908 Devices, Inc. for a handheld high-pressure mass spectrometer for the Stark County Type 1 hazmat team in an amount not to exceed $80,907.66 for the Executive Department of Public Safety Emergency Management Agency and declaring an emergency.
Good afternoon, Tommy Smoot, Executives Department of Public Safety, Emergency Management Agency. I'd like to move forward with a bid to 908 Devices to provide a handheld high-pressure mass spectrometer, and this is for the Stark County Hazmat Team. We're actually the fiscal agent for the FY21 State Homeland Security Grant Funds, which is why we're buying it for Stark County, but this is a required piece of equipment that they have to have as a type hazmat team in Ohio. So.
Any questions from the committee?
So moved.
We have a motion on 2023-297. All those in favor?
Aye.
Aye.
Any opposed? The ayes have it. Thank you. And I will call public safety to close at 4:44.
Health and Human Services will open at 4:44. First tonight is 2023-298, a resolution authorizing the executive to execute a grant agreement with Summa Hospital Foundation on behalf of Summa Hospital for a grant in an amount not to exceed $500,000 to further its First Step program at its emergency departments throughout Summit County for a period of 10/1/23 through 9/30/25 for the executive and declaring an emergency.
Councilwoman, if I could just
Yeah, go ahead.
give some brief comments before the next two pieces. You'll be hearing, very identical pieces next for both SUMA and Cleveland Clinic Akron General. This council generously awarded $1 million to each system back in late 19, early 2020 as a result of the litigation settlement. Those were some of the first funds that council authorized investing back into the community for the expansion of SUMA's ED program, which is called First Step, and for Cleveland Clinic to get theirs off the ground, which is called Recovers and Reach. And as we all know, just a few short months later, the narrative from hospitals was stay out of the emergency room. And so there was a significant, not slowdown, it was just halted their efforts at that time, which is why we agreed to extend that grant period that we had originally asked council to approve. And now they are back for hopefully your approval of another $500,000 for each to continue that work. This new grant is a little bit different. It will require reimbursement rather than just the upfront to stand the programs up. And we've worked very diligently with public health to identify some of those metrics that we'd like to see so that we can bring those back to you to show who's being served, how they're being served, and what the outcomes are. We've got folks here from SUMA. Jamie's here. We've got folks here from Cleveland Clinic Akron General. Team from Public Health is also here to talk to you just generally if you have any questions about the efficacy on a public health level, the cost savings that programs like this present, and the assistance that it provides in helping to reduce stigma when we can tell folks that any public hospital in Summit County, if they go to the ED, their addiction will be treated like the health emergency that it is.
Thanks, Greta. Sir, you want to give your name and organization for the record?
Yeah, my name is Jamie McKinnon. I'm Vice President for Behavioral Health at SUMA Health.
Great, thank you.
So I'd like to just give a little bit of information on the progress we made during the time frame of the grant. First of all, First Step is an ED-based addiction program with an RN present 12 hours a day making referrals. They screen patients not coming in for addiction to identify those that don't have it as a primary diagnosis, complete withdrawal assessments, and work with the providers to initiate that medication-assisted treatment within the ED. They're heavily involved in the care navigation and care coordination, so making sure they have an appointment for ongoing treatment once they leave the ED, and for patients that aren't interested in medication-assisted treatment, what type of treatment is makes the most sense for them and they're willing to participate in, and then making that connection. They connect patients with peer recovery coaches from Catholic Charities, and they're on call to the EDs 24/7 and provide case management services for substance abuse disorder. We dispensed over 900 naloxone kits within the time frame. We've initiated 797 patients on buprenorphine in the ED, and their follow-up appointment to that first appointment was 78%, 71% for counseling and detox-related services. And we've participated in grant activities with the Ohio Department of Health, in which we worked with Cleveland Clinic and Akron Fire and their quick response team to initiate treatment pre-hospital, so offer it to them, at their home. Question?
Thank you. Any questions for Jamie? Sure, go ahead, Gloria. I figured you might.
So this is secondary treatment. They come in for a primary illness, and this is picking up a secondary need for drug treatment.
No, it can be primary, but either we do screening just to try to catch those that aren't coming in with that primary. So a lot of abscesses and things like that related to IV use.
Yeah. Public health care, private insurance, both.
Both.
How many have we treated since we implemented that $1 million? Or have you made referrals for?
Yeah, 2,223 patients.
And you said there's a follow-up process to be sure they at least keep the appointments?
Yeah, the addiction care coordinators track with the referring agency, whether it's internal to Suma Health or to Community Health Center, Portage Path, Summit County agencies.
How many agencies do you refer to?
Oh, probably 20, yeah.
Private insurance is through SUMA or Medicare, Medicaid?
We have some that we send to IBH for residential. It really depends on the level of care that they need.
Do you have any breakdown on the demographics of the folks you've served? Are they all Summit County residents? What are their racial breakdown, age breakdown?
I do have that, but not with me.
Great.
I'll facilitate that being sent. I'll send it through Mark.
Thanks, Greta. Go ahead, Jeff.
You said you served 2022 patients since this began. That's just SUMA.
Any other questions? Mr. Schmidt?
Thank you. And this money is coming from the opioid settlement,
Yeah.
Phil? Okay, thanks. Madam Chair.
Oh, sorry, go ahead.
Just a quick query, it may not be. Ms. Greta, have we done any work with like Children's Hospital too?
I actually was on with Public Health this morning. We have been talking with them about some care coordination in schools. There's actually a piloted program that's already happening right now through the Summit Education Center, where essentially a care coordinator is placed with the school district to try to do some of those interventions, identifying sort of the pre-addiction stages to try and get to the problem before they end up in the emergency room. But yes, we're in discussions with Children's.
Thank you.
One more follow-up.
Sure.
That was an excellent question, Veronica. How do you coordinate with Western Reserve at all?
They have not been a part of the emergency department program, but they have been part of the entire process. They have always had a representative on the opioid addiction, AAC. Why can't I? Advisory Council. I lost the AC at the end, sorry. Yes.
Well, I'm just wondering why not. I would imagine that Western Reserve gets overdose.
We put out the RFP for emergency services, and the two hospitals that responded were Cleveland Clinic, Akron General, and Suma.
So Western Reserve did not respond?
Correct.
And if they had responded, we would partner with them? in all likelihood?
I'm sure we
Okay.
would. There are also grants through the Ohio Department of Health that helped stand up these programs initially.
Okay. Well, maybe I'll reach out to them and see why. Thank you. Thank you, Madam Chair.
So with our new system, the way they triage the folks that come through and get them to other outside support systems, will they enter our system in that way?
Yes, part of our contract will require participation in Unite Us so that we can make sure we're keeping track of folks and that we're getting buy-in. And, you know, it's one of those systems that is as good as the information that is put into it.
Yeah. Thank you. Thank you, Madam Chair.
Other questions? Ms. McKinney, do you want to move on this? A motion from Ms. McKinney on 2023-298. All those in favor, please signify by saying aye. Any opposed? The ayes have it. 2023-299, a resolution authorizing the executive to execute a grant agreement with Cleveland Clinic Foundation on behalf of Cleveland Clinic Akron General Hospital for a grant in an amount not to exceed $500,000 to further its Recoveries in Reach program at its emergency departments throughout Summit County for a period from 10/1/23 through 9/30/25 for the executive and declaring an emergency.
Good afternoon. Jonathan Sanchez, Emergency Nurse Manager and Program Coordinator for Recoveries in Reach. So Recoveries in Reach is an Akron General-based program. Originally started in our main hospital's emergency department, has expanded to all 4 of our emergency departments. The 3 others are located in Bass, Stowe, and Green. To date, we have serviced all of our emergency departments at all 4 sites are screened. But to date, we've identified those with substance use disorder as a primary or secondary diagnosis with 1,513 patients. Out of those 1,500 patients, 645 have accepted services with a recovery coordinator. All of those we do follow up with on 30-day basis, so 30, 60, 90, 120, up to a year, to see if those patients are still continuing service with the referral or placed recovery centers that we've gone through, whether it's outpatient or inpatient. While they're staying in the emergency department, they are connected with a peer coach through Catholic Charities so that they can get that real life experience and the support that they do deserve while going through recovery. And probably that we can say it's not many, but we have 60 individuals who have maintained sobriety since starting the program.
Any questions? Go ahead, Gloria.
You both mentioned Catholic Charities. So they sound like a primary support, is that correct?
Correct.
And they come in and do,
We contact them, they come into the emergency department, and they meet with the patients as well. And many of these individuals, they're counselors licensed by the state of Ohio they are recovering addicts themselves with substance use disorder, so they can give that real life experience to what to expect.
Councilwoman Rogers, Catholic Charities is the premier training grounds for peer recovery. So the one thing that we've found, both anecdotally and statistically in this community, is that one of the ways, however you judge success, is that it requires peer support. And so Catholic Charities has really been the primary provider of training for folks to become certified peer recovery. This isn't just somebody showing up and saying, hey, I've been there too. These are folks with professional training. The other part of that is so that pieces of that can be reimbursed and can be billed.
so are we supporting Catholic Charities in addition to this for the services that they're providing or the training that's going on?
So we have in the past, they have grown significantly. They're supported by ADM for that right now. But they are ancillary, in an ancillary way, supported because they are the primary provider of that for both ED services.
I just didn't realize the part they played. That's interesting. Thank you.
You're welcome.
Thank you.
Mr. Wilhite?
Yeah, if my math serves me, and I didn't do well in math, but we're at 3,535 between Akron General and SUMA that we've helped. And to John's point, we don't know what Western Reserve would add to that number, and then also what Children's would add to that number. Could we get kind of an overall total? Because that, to me, that tells the story on why this is important to support, because that's a lot of individuals. And if they are in fact getting help, the whole idea behind the opioid initiative to go after what we did was for the benefit of people who were in trouble. And I think this clearly supports that was a wise move, and we're seeing the results. So it'd be great if we could just get an overall total to tell the community.
Sure. I'll tell you, no offense to the hospital folks in the room, they're notoriously bad about wanting to share information. So having them participate in Unite Us, I'm hopeful is the next first step. We actually talked this morning, Megan and Corey and I did, about Children's Hospital, who are even more notorious about not wanting to share information, and all for good reason. So certainly we'll make that inquiry. I don't know, I always say I like to give bad news, not surprises. I don't know what we'll get back, but I'm certainly willing to make the inquiry.
Yeah, and not any specific information on any of the individuals, just the total, because that's an impactful number to be able to say to the community at large. And I appreciate the proprietary nature of what they have to be involved in. But to me, that just cements solidly that was a smart move to do that whole initiative. And it took a lot of work, took a lot of time and energy, and now it's producing.
And I would tell you that all of these meetings we've been having, the health department has been integral in sort of walking us through that. And the other partner we've had in all of this is ADM. And Director Wade has been at those meetings lockstep with us, because as someone who does not understand billing, I struggle to understand my own bills that come from hospitals. I needed to have a better understanding of what we were paying for, how that's reimbursed, things like that. So it has been a true partnership between the hospitals, the health department, ADM, and the executive's office up to this point.
Ms. Sims?
Just really quickly, but as it relates to demographic data, that should be pretty easy to get zip codes, race, I would think.
I will provide to you everything that's been provided
He's
to
got
us.
some. Hold on.
Yeah, I mean,
Go ahead.
Yeah, I do. So those out of that 1,500 patients, 1,065 reside in Summit County. For demographics, our highest age population are those who fall between 18 and 39 years of age. Second is 40 to 45. Whites are 71.8% of those who do present to the emergency department. African American. I'm sorry. Oh, repeat it. For the ages, so ages are 18 through 39 is our highest age bracket of 50.5%, and then whites make 71.8% for those who come into our emergency department. You're welcome.
so what are the other demographics?
We break it down.
Racial demographics.
Racial demographics, we have African American, Asian, American Indian, Native Hawaiian and Pacific Islander, Middle Eastern.
So what's the two next highest groups?
Next will be African American and then Asian. African American is running at 26.7%, and Asian is 0.5.
So really quickly, was Akron General who we stood up, or who was already functioning? So
SUMA piloted the First Step program at their Barberton ED, 2017, 2018. They were originally funded by United Way, at least partially, and so the money that you all agreed to invest helped them open that program up to their other campuses.
So the data, the information you just gave us, the 1065, these are all Summit County, so the 71%, is that related to the 1065 or the 1513?
The 1065.
Okay. So you all are providing these services in all of your emergency departments.
Correct, yeah.
So that's
The majority of them come through our main emergency department at Akron, at the hospital. Yes, that's the main of
so
it.
Summit County and Cuyahoga County?
These are
Just, these are all Summit County,
okay.
these are all Summit County locations.
Okay.
Mm.
Thank you.
You're welcome.
Thank you very much.
Any other questions? Mr. Wilhite, would you like to move on this? I have a motion from Mr. Wilhite on 2023-299. All those in favor, please signify by saying aye. Any opposed? The ayes have it. 2023-300, a resolution confirming the award by the Board of Control of a purchase contract with Visual Edge IT, DBA Graphic Enterprises Office Solutions, Inc., a Sourcewell Public Cooperative Purchasing Association, competitively procured pricing for 6 copier machines in an amount not to exceed $62,395.40, utilizing the internal lease fund for the Executive's Department of Job and Family Services and declaring an emergency. Hello.
Hello, Jenny Dobbins, Spec Job and Family Services. This is kind of a straightforward purchase. We want to move and remove some machines that we have and decommission some of our higher usage machines. A lot of them get thousands and thousands of copies a month on them. We haven't upgraded in a while, so we're going to add these machines and move some around. You did mention we did buy this under Sourcewell Cooperative Purchasing, so it gives us a very good rate. The reference to the lease fund does not mean that we're leasing this. We're actually purchasing this outright, then reimbursing the lease fund that the county has. It lets us spread our costs out. It saves us quite a bit. If we lease directly from the company, it'll cost us about $12,000 to $14,000 more. So we decided to go this route. It's the most cost-efficient and best on our budget in-house. So, any questions?
Any questions? Ms. McKinney, do you want to move on this? Yes. I have a motion from Ms. McKinney on 2023-300. All those in favor, please signify by saying aye. Any opposed? The ayes have it. Thank you so much. Health and Human Services will close at 5:04.
And we will open up financing at 5:04. We have one item, 2023-301, a resolution confirming the award by the Board of Control, subject to the approval of Information Technology Board, of a purchase contract with Avenue Insights Analytics as best practical source for Banner annual support and maintenance for a 12-month term from the period of 1/1/24 to 12/31/24 for a total price not to exceed $257,041.51 for the Office of Information Technology and declaring it an emergency.
Stephen Burton, Office of Information Technology. So just as the description is, this is for our finance system. This will be the last year that we are on this current finance system as we make our transition into the Munis.
Former finance system.
Former finance system. Yes.
Phil's so excited he's throwing stuff.
We're all getting real excited about this one. Any conversation?
Talking about the money.
Money. Any questions from committee, council?
I'll move on this.
Ms. Walters moves on 2023-301. All in favor?
Aye.
Opposed? Motion carries, and we will close finance out at 5:05.
Thank you. Before we go into our special council meeting for this evening, we have Ms. Apostolette to address council. You guys don't have to leave.
You can stay if you're interested.
I didn't run you away, did I? Good evening, everybody. Council President Sims, council members, staff, and those leaving. Good evening. I had an interest in Resolution 2023-296. Thank you for being on the same page with me with recidivism. And I just wanted to share a little information so that you would consider it in this resolution. Not only am I concerned about recidivism and mass incarceration and family generational patterns that repeat the pattern of mass incarceration and recidivism and some other things. I just wanted to share a little history this evening so you would take it into advisement when you pay the medical professionals to come through the jails and the incarceration process. For one thing, I want to make sure the medical services not only include just medications, but equipment also. I know at one time there was another person in another jail system who was disabled, and because he didn't have money, they wouldn't give him a wheelchair. And he was a repeated person. But I wanted to go a little bit further because Thomas Corwin, who was a legislator, a federal one, from Ohio, there's a Corwin Amendment which was to be put in place inside the 13th Amendment of the United States Constitution, stated that slavery should never be abolished in the United States of America, and it came from Ohio. And it can be implemented if someone broke the law. So I brought that to your attention. Not only was he a federal representative, a federal senator, the governor, and the secretary of the Treasury of the state of Ohio, but I hope that in the medical processes, that as you find people to give them medication to operate in the community, that you would also provide them with provisions where they don't need the medication. I heard you last time, Mr. Wilhite, say that you have a group, you have a relationship with a group home some type of way. But I would like to see, I'm a retired probation officer, and I didn't get the opportunity to help people like I really wanted to, because the goal was to incarcerate everybody to make money for the system. And I didn't get the opportunity as a probation officer to meet the needs of the people through the community resources so people don't have to be incarcerated. When people go through the jail system, I ask that as you provide these medical services through these programs and these entities that you have in place, that we do work a little harder and a little deeper to avoid not only recidivism, but this mass incarceration and other concerns that bring people into the process. Thank you very much for your time.
Thank you, Ms. Apostolette. We will now call to order the special meeting of council, October 2nd. We'll all rise for pledge of allegiance led by Councilwoman Hyam, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Roll call, please.
Mr. Schmidt,
Here.
Ms. Hyam.
Here.
Mr. Donofrio. Mr. Davidas. Ms. Dickinson.
Here.
Ms. Sims.
Here.
Mr. Wilhite.
Here.
Mrs. Darrow. Mrs. Rogers.
Here.
Ms. McKinney.
Here.
Ms. Walters.
Here.
2023-296, an amended resolution confirming the award by the Board of Control of a professional service contract with Vital Core Health Strategies, LLC, to provide jail inmate medical services for a 3-year term from December 1st, 2023 through November 30th, 2026, with 2 options to renew for additional 3-year terms, and a total amount not to exceed $9,083,078.39 for the sheriff. Emergency.
Madam President, I move to suspend the rules and adopt 2023-296.
We have a motion to suspend the rules and adopt 2023-296. On the suspension, all in favor, please signify by saying aye.
Aye.
Any opposed? And on the adoption, all in favor, please signify by saying aye.
Aye.
Any opposed? The ayes have it. There's nothing else to come before this body. We are adjourned.
Thank you all. Thank you.